Those protesters greeted Republican senators today when they headed to the White House to meet with President Trump about the Republican Senate health care bill. Joining us now, Dr. Atul Gawande, a Harvard Medical School professor and staff writer for The New Yorker. Doctor, I know you have studied the effects of simply having health insurance, having health coverage on people's long-term health. What do we know?
So what we've learned is a few things, that almost immediately upon getting coverage, people start to get access to primary care, preventive care. They also get their needed medicines. They're more likely to get a regular source of care, needed medications, and chronic illness treatment. The result of that is they have improved health pretty quickly. Overall health and mental health start being better treated and get better outcomes. And then about 4 or 5 years into it, we see substantial and growing reductions in mortality, about a 6% reduction in mortality at 5 years. And that's a very big deal.
It's easy to talk about elements of the Republican bill that are the massive losses of coverage, just people going from being well covered in effect under Obamacare to nothing. There's 22 million of those. But even the people who would manage to hang on would be hanging on to something that would be much, much more expensive for them if they can hang on.
Yeah, I think this is really important to understand. It's not just the 22 million uninsured. It's the vision of a health system where the average insured person has a $6,000 deductible and no primary or chronic care coverage. And that's what we see in the exchanges under the Senate proposal.
And talk about what happens in the higher age brackets. You've written about the example of a 60-year-old man, one version of it in Alaska, one version of it in another state, where they end up paying, in Alaska, the premiums would be $36,000 on such a policy.
That's right. 60 years old, $50,000 of income. My hometown is Athens, Ohio, in southeastern Ohio, and there the jump in the premiums people pay is triple what they are currently paying under Obamacare, so it goes to $15,000. And in some parts of the country, it gets to $36,000, $38,000. The shift of the cost, you know, basically, here's the challenge. You can't take $1 trillion out of the healthcare coverage system, tax revenues that had been brought in for coverage, take it away and expect you're not going to be hurting people's care and hurting people's coverage. And then the results look like these kinds of large costs that even the insured people have to pay. So they're paying much more for much less coverage with very high deductibles and not really the good care, the primary and chronic care that is where the biggest reductions in mortality and the biggest improvements in health come from.
It seems the one number that the Republicans have concentrated on is the actual premium, and that's the number that I think probably most healthcare consumers are aware of, how much they write in that check every month to pay for their insurance policy. And what's less visible are the deductibles and the other aspects, the non-covered care for which deductibles and premiums don't matter. You're just going to have to pay out of pocket, all of that. And so when you look at the overall cost of what would be left of healthcare policies under this new system, that has gone up enormously, even in the cases where some of the premiums have gone down.
Yeah, the crucial thing to understand is that when the premiums go down, it's only because there is poorer coverage. So if you had a silver plan under Obamacare in picking up from healthcare.gov, that covered 70% of your costs. The proposal would make it so that the standard plan available with coverage would be just over half of your cost coverage. So that's a big amount that's really left for you to have to deal with, and that's what hurts people's health.
And I think this is what Mitch McConnell knew was going to come out in any debate this week, and if this bill comes back to life, we'll be hearing a lot more about all those other numbers beyond just the premiums. Dr. Atul Gawande, thank you very much for joining us tonight. Really appreciate it.
Thank you.
The 11th hour with Brian Williams starts now.
Tonight, a public